Hello, welcome to Myers Counseling Group podcast. We offer information on mental health, substance abuse, and wellness concerns for the community. To find out more about Myers Counseling Group, to access previous podcasts, and for additional resources, visit us at myerscounseling.com. Hello, today we'd like to welcome Dr. Larson. Dr. Larson is a corporate medical director for Gateway Foundation Alcohol and Drug Treatment. Thank you for talking to us today, Dr. Larson.
Thank you.
Tell us a little bit about your program, what kind of services you run.
Okay, Gateway's been around a long time. It used to be primarily a service for Medicaid and DASA clients, and over the last few years, it's evolved into kind of a full service program with insurance clients, Medicaid, and again DASA. We have sites, full service sites in the west side of Chicago, Lake Villa, out in Aurora. We have another full service site in Carbondale, and one in Springfield, and then an outpatient program in Pekin and River North in Chicago. And the full service programs have basically not inpatient but residential and intensive outpatient and outpatient services. So pretty much covers the full gamut of the types of services that addicted individuals need, except for a really ill person who is going through detox and might need hospitalization.
Okay, and then at that point, would you work with a hospital for the detox?
Yes. Yeah, we have affiliations with hospitals at each of those sites where we would send somebody for the acute medical detox and then bring them back to our facility for treatment.
Great. And how long have you been there?
I've only been with Gateway a couple of years. I've been working in the addiction field for about 15 years. I was in the general practice of psychiatry before that. I was at Rush for a while. And then the division I was working for was purchased by another healthcare company, which is now Presence Health. It used to be Resurrection.
I'd like to ask some questions here. My first question would be is what types of substance abuse problems do you see? What are the more commonly abused drugs you're seeing now?
Well, it's a full gamut. It's probably the majority would be heroin and alcohol would be the two probably most common diagnoses, particularly in young adults and adults. It varies a little bit depending on the part of the state that it's in, the program's in. Downstate, there's a lot of K2, the synthetic marijuana issues. Meth kind of comes and goes. Heroin is growing, as everyone I think knows. It's inexpensive, and there's kind of a heroin epidemic going on, particularly in the Chicago suburbs.
Are you seeing the heroin use as injectable? Or are they injecting or are they snorting?
Both, but mainly the injectable route.
Regarding individuals' use or drinking, what are some gauges that you would use to identify if they're a problem drinker? So let's start with the drinking. How would they know if it's a problem? What kind of feedback would you give them?
Well, there's some, the NIAAA has some guidelines about what's kind of normal drinking patterns. And they're a little bit liberal, in my opinion. It's, 12 to 14 drinks a week for a male, half that for a female, no more than 4 drinks at a time for the male and 3 for the female. And beyond that, it's problem drinking. I would suggest, though, that if it's affecting your work function, your interpersonal relationships with friends and family, spouse, children,
If someone is taking medication for a mental health issue, how could either alcohol or substance abuse impact them?
Well, all the substances of abuse affect brain chemistry, so they interact with any medication, whether it's an antidepressant, an anxiety medication, or an antipsychotic or a mood stabilizer. So it affects the way the medication is absorbed. It affects the way it interacts with brain chemistry. There are some drugs, like marijuana, that have their own problems with producing psychotic symptoms, particularly the K2 and the higher potency forms of marijuana. And, of course, alcohol and central nervous system depressants like benzodiazepines and even heroin affect mood and can wreak havoc with somebody who has bipolar disorder.
Mm-hmm. What guidelines would you follow or suggest to your patients who do want to continue drinking while they're taking medication?
Well, I encourage them to keep it to. Personally, I would, if they were my patient and I was giving them the best advice possible, I'd use some kind of motivational interviewing techniques to find out to try to get some collaboration going. But the bottom line would be to try to get them to see that more than one or two drinks at a time, more than a few times a week, is potentially problematic, and drinking to intoxication would be something they should definitely avoid.
Mm-hmm.
If somebody's kind of at an unstable point in whatever their psychiatric illness is, whether it's an anxiety condition or depression, I would advise them to be abstinent for a while until the medication is adjusted and their condition is stable.
Excellent. Okay, so some length of some length of abstinence before considering going back to drinking.
Yeah.
Okay. What type of medical issues could present themselves with someone who's a heavy drinker?
Well, alcohol has an acute effect, which it's a solvent like gasoline or cleaning fluid, and it's acutely toxic, so it passes through the blood-brain barrier very quickly and affects cells in the brain, cells in the heart muscle, and the liver predominantly. So it has an acute toxic effect. With chronic drinking, there's a brain syndrome called Wernicke's encephalopathy, which is reversible.
Mm-hmm.
With vitamin supplementation and avoidance of alcohol. If they continue to drink, it becomes permanent. It's called Korsakoff psychosis. Of course, there's fatty liver damage that occurs, and if they continue to drink, that develops into cirrhosis of the liver, which is permanent. And then there's a cardiac condition with heavy drinking that it can also be fatal. So predominantly brain, liver, and heart. That's, of course, aside from things that happen while you're acutely intoxicated, like car accidents and falling down the stairs and those kinds of things.
Right. And how long does it usually take for someone to physically be stable after long periods of drinking? How long before their body recovers from that?
Well, there's acute withdrawal, which typically is around a week, where somebody who's drinking heavily is at risk to have seizures and develop full-blown DTs, which can be fatal. But that acute risk passes like I say, in about a week. If somebody's physically compromised and in poor nutritional status, it could take a couple of weeks, but usually that acute risk is over by then. After that, there's a kind of a post-acute withdrawal where somebody may feel agitated, have strong
Mm-hmm. Do you recommend or use medication to address urges, or for drinkers or users who they would experience urges in recovery?
Yeah, the evidence is not overwhelming, but the studies that have looked at, let's talk about alcohol first. Vivitrol, which is an injectable form of a drug called naltrexone, which blocks the opioid receptors in the brain, and those receptors, if they're blocked, it kind of decreases the euphoric effect that people get from drinking. So what happens is somebody's taking Vivitrol or naltrexone, even in oral form, and they're reliably taking it. They may have a relapse where they drink a drink or two and don't feel any particular buzz from it, and stop, kind of lose interest in continuing, and then hopefully reconsider their decision and get back into treatment or participation in 12-step meetings or whatever they're doing to recover.
Would there be any risk if they continued to drink with taking that medication?
No, not any substantial risk, no. There's the old Antabuse, which still has its uses, which there, of course, is a risk. If somebody drinks on Antabuse, that can be fatal. The Antabuse does nothing really until somebody uses alcohol, and then it blocks its metabolism, and you end up with your body full of basically a cousin of formaldehyde, and you get what feels like a severe hangover, and like I say, that can progress to a point where it's fatal.
Mm-hmm.
But that can happen even with just a single drink. So there are a couple of other medications, Camprol or acamprosate, which I'm just kind of lukewarm about because I haven't seen great results with it, but it does help some people in that post-acute period where they're having trouble sleeping and they're kind of irritated. So that's another one that's FDA approved to use in alcohol treatment. And then on the opiate side, we've got Suboxone, which is it's what we call a partial agonist. So it acts on the same opioid receptors in the brain, and it's a partial agonist, so it does a little bit what heroin and opiates would do, but weaker. But it tenaciously grabs those receptors and blocks anything else from attaching. So if somebody uses heroin, they get very little euphoria from it. We advise somebody who's taking Suboxone not to try to override it because it doesn't prevent them from getting respiratory depression and having to overdose from heroin if they try to override it. But it not only reduces the acute effect of taking an opiate, but it also seems to reduce the addict's craving for opiates, and they can function normally. The advantage of Suboxone over methadone, which is a similar philosophy, the advantage of Suboxone is you can get it from physicians' offices who are licensed to prescribe it. You don't have to go to a government clinic like you do with methadone, so it's more accessible. And also back to the Vivitrol for a second, alcohol-dependent patients also report a decrease in craving when they're on it. The shot lasts about a month. Incredibly expensive. It's about $1,000 a shot, but it's covered by insurance companies now for the most extent. And so at Gateway we use both those approaches whenever they're appropriate. Acute detox, we still use benzodiazepines like Librium or Valium or Ativan, which are very safe to give, and you just quickly reduce the dose and get somebody quickly through withdrawal in that week period.
Mm-hmm. And you said about a week, usually?
Yeah, about a week. And phenobarbital, an old drug, is also kind of back in vogue, and it's very safe and effective too. You just want to keep somebody from progressing to the point where they're at risk
And there's been a lot of discussion regarding legalizing marijuana, and without getting into the politics of legalization, do you see marijuana as being a safe drug?
No, it's not a safe drug. I have mixed feelings about legalization because we've spent so much of our limited resources on putting people in jail for possession, and it just seems like such a waste of money and people's lives to try and enforce the current laws. But marijuana is not an innocuous drug. We know there was debate for a long time about whether it was addicting, whether there was a withdrawal state that occurred when somebody was using heavily and then quit. And the evidence is pretty solid that it is addicting and there is a withdrawal. It affects brain development in adolescence to a negative extent. So it's not an innocuous drug. It's neither is alcohol. So you don't justify legalizing it with the argument that it's harmless, because it's definitely not. And like I said, somebody who has the possibility of an underlying schizophrenic illness or psychotic illness, the marijuana can precipitate that pretty significantly.
Well, you've covered all our questions here. I really appreciate your time. And I think, would there be other additional information, that anything as far as the medical aspects of drug or alcohol treatment, how that could be incorporated into the, addressing drug and alcohol issues? Any other bits of information that you think would be helpful to share with people?
I can't think of anything offhand. The only thing, I have kind of a pet theme that I liked whenever I get a chance to talk about it, and you have people that hopefully we can influence a little bit through this recording, and the notion that drinking during adolescence is just something to be accepted and kind of winked at. The adolescent brain is developing, especially the frontal cortex, the part of the brain that helps us delay gratification, make plans for the future, work hard now for a reward down the road, making good decisions. That part of the brain is still developing, and it's very sensitive to any kind of substance that messes with brain chemistry, including marijuana and alcohol. And I think that certainly adolescents should know that they're taking some real risks in the long run. I know that doesn't deter a lot of them from doing it, but just for those of us who are in a position to say something about it rather than winking and just accepting it as a fact of life, in terms of people making those decisions with the information they need. Adolescents need to know that, and that part of the brain continues to develop up through the early 20s. So the binge drinking in college is just it's a plain Russian roulette with your brain. So just I like to fit that in.
Right.
Whenever I can.
There's a good information to add to that. Again, Dr. Larson from Gateway Gateway Foundation Alcohol and Drug Treatment Center. We appreciate your time. And again, thank you for the information. Very helpful.